Mr. Chairman, I rise today in support of my legislation, H.R. 5735, the Transitional Housing for Recovery and Viable Environments Act, or the THRIVE Act. I want to thank Chairman Hensarling, Chairman Duffy, and my colleagues on the House Financial Services Committee for their support and feedback on this legislation. I want to thank Chairman Hensarling for sharing that very compelling story about his constituent Joshua. Unfortunately, so many of us have constituents with similar stories, and that's what we're trying to address here today. We all know the opioid epidemic is a major health crisis that has impacted every community and every congressional district. 116 Americans die every day from opioid overdoses, and my home state of Kentucky has the third highest overdose mortality rate in the country. This week, the House is considering several pieces of legislation to address this epidemic, and in order to achieve meaningful progress in the fight against opioids in our nation, Congress can no longer simply focus on prevention, enforcement, and treatment. We must also begin to implement policies that focus on long-term recovery. Our federal housing programs are an underutilized resource in these efforts. The THRIVE Act would make supportive housing more accessible to those most in need by allocating a limited number of Section 8 housing choice vouchers to nonprofits that have experience in housing, not new nonprofits with a record of providing housing services, workforce development, job placement, financial literacy, and continued addiction recovery support for individuals who are transitioning out of rehab or a period of medication-assisted treatment and back into the workforce. This legislation would only allocate either $10,000 or 0.5% of total housing choice vouchers, whichever is less, to evidence-based nonprofits serving people who are literally dying each and every day of opioid addiction and other substance abuse disorders. And the demonstration is limited to 5 years. No one would have a voucher taken away from them, despite what my friend, the gentlelady from California, is saying. No one would have a voucher taken away from them to create this demonstration program. An estimated 198,000 Section 8 vouchers are turned over every year and returned to HUD. And it is from this amount that the demonstration would set aside only $10,000 to address a deadly national public health crisis. And additionally, we've made a commitment to working with our Democratic colleagues, including Congresswoman Sinema, who has signed and joined a letter with me to request additional funding from the Appropriations Committee to support this demonstration, because we understand the urgent need for greater federal investment to save lives. So the ranking member's argument really doesn't apply. The THRIVE Act has received endorsements from over 140 housing and recovery organizations across the country, including Addiction Policy Forum, the American Academy of Addiction Psychiatry, National Association of Social Workers, Faces and Voices of Recovery, the Association for Addiction Professionals, and over 100 others that are on the front lines of addiction recovery. And HUD Secretary Ben Carson visited several transitional nonprofits in my district in Kentucky earlier this year, where he witnessed firsthand this.
30 seconds.
Gentleman's recognized for additional 30 seconds.
Thank you. Where HUD Secretary Carson visited these transitional nonprofits in our district earlier this year, and he witnessed firsthand the success of these evidence-based models of recovery. And I'd like to especially recognize St. James Place, Revive Life House, the Hope Center, Shepherd's House, and Chrysalis House, among others, for their critical work in the 6th District of Kentucky that inspired this legislation. Mr. Chairman, the THRIVE Act would save American lives as well as taxpayer funds in the long run by helping more individuals rise above addiction and poverty. Thank you, and I yield back.
The gentleman from Kentucky yields back the balance of his time. The gentleman from Texas reserves. The gentlelady from California is again recognized.